Hi, everyone. We are thrilled today to be joined by Yoko Momo as well as Phyllis Lamb, who are going to present to us acupuncture for self-care and healing. In their presentation today, the Zhang Clinic will introduce a general idea of acupuncture, what it is, how it works, and what conditions it can help based upon the current research. Then they'll follow by a demonstration of self-acupuncture treatment, which for various types of pain or discomfort commonly experienced by gynecologic cancer patients. Today, we hope that you learn to apply this new technique to heal yourself and your significant others. So in one of our groups, we discussed common symptoms that might be experienced by our community, and I gave Yoko a long list. And so she was familiar with this already, but we just reminded her. And this is a list from all of you. And she'll talk about how acupuncture can help with some of those symptoms. So Yoko and Phyllis, thank you so much for joining us. And the floor is yours. Thank you. Also, everyone, if you have questions, you can put them in the chat and they will get to them throughout the session. Thank you again.
Okay, thank you for having us today. Hello, everyone. My name is Yoko, and Phyllis just left, but this is Phyllis. We are New York State licensed acupuncturist with over 15 years of clinical experience. Okay, so here are the topics we like to cover today. We start with a basic overview of acupuncture, followed by the demonstration. Acupuncture is a part of traditional Chinese medicine. The other major components of TCM are herbs, nutrition, exercise, cleanup, the massage-like manipulation, cupping, mox, which is a type of heat therapy. TCM is a medical system that emphasizes holistic treatment and preventative care. So, acupuncture. What is acupuncture? Okay. WHO reported acupuncture is the most common form of traditional medicine practiced globally. In the US, the NYU Langone Medical Center showed that more than 10 million acupuncture treatments are administered annually in the United States alone. The practice of acupuncture involved inserting thin sterile needles into specific points on the body. According to TCM, illness arises when the flow of qi, the vital energy of the body, becomes impeded or imbalanced. The goal of acupuncture is to restore the flow of and balance of qi, which in turn restores the body's innate healing abilities. So what are some ways we can explain how acupuncture works in terms of modern science? Many studies have shown that acupuncture stimulates the central nervous system. This is studied by Han and others that demonstrate the effect of acupuncture on the brain using functional MRI. DU15, SJ8, KI3, these are the names of the different acupuncture points. This image shows that specific acupuncture point triggers specific responses in the brain. In this study by Takayama and others, scientists used the type of ultrasound to visualize how acupuncture treatment can affect blood flow in the body. Here, they put the needle on the foot. They found increasing blood flow in the arm. To summarize, acupuncture stimulates and regulates the nervous system to promote healing. It can stimulate the release of hormones such as endorphin to relieve pain. It can promote blood flow and facilitate healing and recovery. It can activate the parasympathetic nervous system to promote mental relaxation and well-being. So let's go over what actual acupuncture treatment session like. First, the needles. Please take a look at the picture. The blue top needles are my personal favorites. You can see that they are very thin, much smaller than the standard syringe needle. Most people don't feel much when we insert the needles, so no worries. Every treatment session starts with a consultation, and acupuncturist assesses the patient condition and forms the point prescription, which is usually 10 to 20 needles. Then the needles are inserted and retained for about 30 minutes. Most conditions require continuous treatment for their sustained effect. We recommend weekly session to start. Acupuncture is safe as long as it's done by a licensed or certified practitioner. To become licensed, acupuncturist needs at least a master level education, 650 hours of clinical experience, and to have treated at least 250 patients. They also need to pass the National Board Licensure exam and attend continuing education to hold the status. Some possible side effects of acupuncture treatment are minor bleeding, bruising, soreness, and localized pain, fatigue, and dizziness. All licensed acupuncturists are trained to follow a clean needle technique. Infections are highly unlikely, but it's still a possibility in some rare cases. More serious side effect is a puncture to the lung when needling in the chest area. Many studies have done on the safety of acupuncture. This is a study by Huxterman and others. They analyzed 65 acupuncture studies for the cancer patients. They concluded that acupuncture is a safe therapy for them. Patients, if you have any of these conditions, you can still have acupuncture, but make sure you inform your acupuncturist before receiving the treatment. Being pregnant, wearing pacemakers, if you have lymph node removed from underarm, for patients who have breathing disorders, taking blood thinners, or have low platelet counts, there is increased risk of bleeding. People who have low white blood cell counts are at an increased risk of infection. Acupuncture works for a wide range of conditions, including pain management, digestive dysfunctions, women's health, and emotional wellness. So let's dive in. According to Acupuncture Evidence Project study and Department of Veterans Affairs study, there is a strong evidence on the efficacy of acupuncture for allergic rhinitis, chemotherapy-induced nausea and vomiting, chronic lower back pain, headache, knee pain, migraine prevention, post-operative nausea and vomiting, post-operative pain. Same studies found moderate positive effect on the following conditions. I'll stop here for a while. Okay. So there have been many studies on acupuncture as a complementary therapy for cancer patient, cancer-related symptoms, and side effect of conventional treatment. You can find more information on this website. So before we move to acupressure exercise, we like to answer some questions. We get any? No. Okay. All right. So would you like to write the question right now, or are you good?
I have a question. You had mentioned that you can have acupuncture if you've had a lymph node removed by the breast. Our patients typically have lymph nodes removed by the groin. Is that how would that impact acupuncture?
Yes, we should not have the needle on the side. If you have right side, you don't want to put the needle on the if it's the groin, maybe in the right side, you don't want to put the needle on the right leg. For the arm, maybe we don't want to put the needle on the right arm. But we can always put the needle to the other side. But it's depending on the condition. That's why you need to inform the acupuncturist, hey, I have this. So we're going to avoid the area. Yes. Acupuncture can be helpful for the neuropathic peripheral neuropathy and neuropathic pain. Okay, there's no like a line, the level of the count we're gonna follow. But if you have very low and have symptom, we might just gonna go very gentle instead of putting the needle. We might just gonna use acupressure or some practitioner has a different modality to help with your symptoms. But if you have any concern or any blood work to show, acupuncturists are trained to read the blood work just to get the idea how cautious we have to be.
Victoria mentioned about the neuropathy, and I'm not sure if this is for later in your in your discussion, but can you share about how many sessions someone should be engaging in acupuncture for when they would experience some results?
Acupuncture, some of the acupuncture research, many are done in Asia, and they usually done multiple sessions a week, and they continue the frequency for 4 weeks to 6 weeks. So when we said the study found acupuncture is very helpful for this condition, that means the idea is the patient had a lot of treatment. But in reality, in US, we usually able to do probably only once a week. And according to my clinical experience, I see patients feel good right away after one session, but some patient takes longer. It's a cumulative effect. But I suggest you to give at least 4 to 8 sessions to give chance for the acupuncturist to work with. Because sometimes the first session, we kind of assess how sensitive you are, how open to the needle sensation. We also like to build the bond between the patient. We like to know you first. So first session introductory, and then second, third, we can probably go a little more, and the patient feels something after the session.
What's the question?
And C, do you see her question?
Yeah. You're gonna read it out so they know.
Okay, so there's another question. Can you explain more about how acupuncture help with parasympathetic nervous system when our nervous system is in fight or flight mode? Yes, so there's certain studies, it's concluded or found acupuncture affect let's say the central nervous system and especially the parasympathetic nervous system by producing the hormone or some kind of hormone to make you feel relaxed. So it's a kind of readjustment when your body's to switch from fight mode to kind of to relax mode. Sometimes through a certain nerve, sometimes it affects like a vagus nerve, but there's a study like that. And
Thank you. Before Yoko goes on, did anyone else have any questions? I don't think so.
I have a question. You mentioned that acupuncture is, one part of traditional Chinese medicine. And I was just curious about whether you recommend acupuncture being done with other types of Chinese medicine, like the nutrition or the other types of therapies that are in that list with the circles.
absolutely, yes. Acupuncture is one of the weapons we carry, and we like to utilize as many as possible. Daily exercise, we might teach you how to do the qigong, the breathing exercise. Acupressure is one of them. Even at the acupuncture treatment setting, I like to use cupping when I like to bring up the blood flow. I like to use heat therapy to, when patient is too sensitive to the needle, maybe I'm gonna bring up more heat instead. So acupuncture is just one part of the tool we carry. And the practitioner, Moksar, we cannot do it here, but yes, if it's deep. So first you have a consultation with acupuncturist, and she or he will come up with the idea. Okay, we like to use this, and maybe nutrition, the Eastern nutrition guidance, maybe herbal sometimes, acupressure exercise, he or she will help you to kind of complete your TCM experience.
Thank you.
You're welcome. So I think it's time. Yeah.
I have one more question.
Sure.
I was just wondering, is acupressure, does it work as well as acupuncture?
Yes and no.
Yes or no?
Yeah.
Acupressure is very powerful. Acupuncture is more precise, and it's based on TCM philosophy. It's not just one point. We use 10 to 20 points. There's a meaning. We open up the energy flow and then nourish one meridian and remove some blockage. It's one session has based on so many different ideas. And each point is very precise because needle is very tiny. On the other hand, but acupressure, we dig 1 or 2 points, but you can do it anywhere you can. That's the strength. In this morning, I use acupressure on the train ride for 30 minutes. And it's really helping me to, I have a little cold today, and it's really helped. So both are very effective in different way. So if you have no access to acupuncture session, I recommend to start with acupressure. We can expect a lot. It's very effective.
Thank you.
You're welcome. Therapy means moxa.
Thank
Moxa,
you.
the Chinese word, yes.
You can lie down.
Oh, yes. And then when you see acupuncturist, usually you see a heat lamp that help. Anything else? So I think we are ready. Okay, so
now's the fun part.
let's do the fun part. So acupressure. Okay, for acupressure exercise today, we apply the gentle pressure to the acupuncture point with our fingers. Most of the point, you can do either both side or just one side where you find more tension. If you can, we encourage the breathing exercise while we stimulating the point. Okay. Okay, so we will start with LI4, which is a very good point for the pain, pretty much anywhere, but especially for the head. This point is between thumb and index finger. Phyllis will show you how to find it and how to massage it. Okay, so make sure you can see us.
Yeah, I really want everybody to try. Okay, some little disclaimer here. Acupuncture porn, right? By definition, is a porn, but actually it's not. It's a translation. In the original text, it is a void that like have energy concentrate. So basically, it's an area. So if I show you the porn, don't go back to your acupuncturist say, "Hey, you are wrong. First, show me a different point." Actually, they were all in the area. But different lineage will have a different exact location. Like anything that like 5,000 years of civilization, right? 3,000 years of history, you will have different lineage. My lineage comes from very close to the bone. You can find all the point I show you is very close to the bone. But some other lineage, they will be a little bit away from the bone. So, but all will be in a similar area. Okay? Okay, the first thing is very easy to do with your hand. Get both hands, right? So if you are a right-handed person, spare your right hand, use the left hand to massage. Use the right hand to massage the left side. If you are left hand, then do the left hand to massage the right hand. So you do the hand this way, right? Okay. You have a right angle here. And then this one also have a right angle. Pair. So we want to do this way. You slide the thumb along the index finger all the way to the end. Go nowhere. Then go underneath. That is LI4. Go all the way to the end. You cannot go anywhere. Then go underneath. You feel a tender point. Everybody find it? Can everybody find it? Okay. Slide all the way to the end. You cannot find. Then go underneath. And in order to massage it, you want to have some ankle, right? So this anchor here and this anchor here. So both hands have anchor as a piece. Everybody find it? Any question? Who cannot find it? You can tell me now. Everybody do it together. You find it, right? Okay.
It's like a tendon or something there. So are you beyond the tendon?
No, you go underneath.
Underneath. Okay.
Underneath, yeah. I know some other places they will, yeah. So you will, some other places they just, I think some people just massage like that, right? You see people, they do this.
Yeah.
Again, my lineage is always close to the bone. So we always do it here, all the way to the bone and go underneath. And this way, the convenience is all these fingers, they got anchor. So you can do it for longer time without feeling tired. If you do it this way, after a few minutes, your thumb will be tired. But here, the whole thing, slide to the end, you go underneath, you can see, right? One piece, you get support, you can massage longer. Yeah. So go underneath. So you press and release. Press and you release. Then your finger, have, rest, right? So when you press, not just this finger, because this one is on top. So both go down. So you have more strength. And then it's not like one thumb, do all the work and then become very tired, right? So this position, your support, go down, release. Go down, release. Everybody find the tender point? You feel, right? Go underneath, it's more tender than on top. You go on top, nothing. Go underneath, ooh, you feel it, okay. Then people ask me, how long to press? Until you don't have strength? No, that's how we get our breathing exercise come in. when we breathe in, you can choose your own regular breathing, or you can do the belly breathing, like a diaphragm breathing, whatever way. But the key is no deep breathing. This is my lineage, okay? Some other lineage may say do deep breathing, no deep breathing, regular breathing. But you can do belly breathing or your regular breathing, but it has to be relaxed. So how we know? Then when we breathe in, we tell ourselves, be quiet. When you breathe out, tell yourself, relax. So don't have to say the word out, but say to yourself. So when I breathe in, be quiet, then I press. And then when I breathe out, I relax. Then the whole body relax. So be quiet, relax. Be quiet, relax. Be quiet, relax. If you look at the clocks, if you do it slowly, that's about 3 seconds on, 3 seconds, 2-3 seconds off. Then your hand will have time to rest. And then do it this way, you can do it for hours without problem. Breathe in, be quiet, relax. Be quiet, relax. And when you breathe in, say be quiet. And when you breathe out, tell yourself relax. It's a simple Qigong, a Qi breathing exercise. Be quiet is quiet all those noises. Say, hey, what are you going to do later? What will we eat for dinner? Where to buy new clothes? Hey, I forgot her birthday. Oh, I made a mistake yesterday. All be quiet, no noise. And relax. You can feel your body, all the joint, all the muscle relax. So breathe in, be quiet, relax.
So we're actually moving our arms. We can't just rest our arms on the table and do this. We have to
Yeah,
move
you can raise your hand, but in order to show you, I do it this way.
Oh, okay.
Very, very good question. Don't follow me. Yeah, everybody. Wow, this is like, people say, wow, what are you doing? Yes, you can definitely learn it, to the most comfort position to have support. But yeah, I show you this way, then you can see. Okay, so then because you have support, so you can do it very long. Then usually people ask me for headache, how long? Depends on situation, around 5-15 minutes should be enough. But if you got a cold, you want to do more than 15 minutes. You said, hey, this is also good for cold. This can stimulate the body immune system. So especially if you got a cold just got a cold, not long time, you did right away, you can feel the running nose and all those will be clear. Yeah, I do that all the time. Like whenever I go to the train, I feel people coughing left and right. And I forgot my mask and I feel my nose seems to be stuffy, do that. Then when I get off, my nose clear. Okay, that's one.
I have a question. Someone wrote in the chat. They
Yeah.
said, what should we do if our hands are too weak, painful from neuropathy to apply pressure that way? And she continued, I can't grip things without a lot of pain.
Yes. So in the old days, everybody got matches at home because we cook with wood stove, right? And in those days, people use matches. Now they had AcuPen. They had different kind of thing, then you can use a tool to do it for you. Yeah. Or you can just grab a pencil with the rubber at the end, you can do that, and then, yeah. And also we have left and right. Remember, just don't do one hand, the other side, right? Do both sides. Yeah. So why we do both sides? Because the meridian is on both. Most meridian is both sides. Some are not. Yeah. And then when you do both sides, you get the stimulation from both sides. And then the other side also can take a rest. My hand can take a rest. If you do it that way, basically you can do forever. This is one advantage of the pressure than acupuncture. You can't really lie flat, don't do anything whole day, right? But here I can do it, and then at the same time I can watch my TV, check my news, I can talk to my friend, do everything. One time we in a classroom, right? 10,000 people, not enough oxygen. We all want to sleep. Then we do this LI4. Everybody wake up. You can do that, yeah, without people knowing. Any question on this point?
Okay. So since now we know LI4, so we will we like to show the acupressure combination for the different kind of headache. We start with the type of headache where you also notice emotionally stressed. For that, we use LI4 and LI4 combination. So LI4, we found a point on the hand, and for the LI4, it's on top of your foot, and it's on the space between the first and second toes. And just like LI4, you try to find the tender spot near the bone. Could you explain the?
Usually,
Mhm.
like you look at the foot, right? It's between the toe, and the big toe. If I assume it is, you go all the way to the end, again to the bone, then you press down. That will be the tender point for the first three. Some other maybe do in the middle. Like again, my lineage is always to the bone, so I go to the end. But then you will see, oh, the liver 3 is very good, but so far away. Wow, how can I press it? Wow, take my toe, and then people look at me. So in acupuncture, one thing called mirror, you can see LI4 is very close to the liver 3, between the two, right, to the end. So when you cannot do liver 3, you can do LI4 instead. That's the mirror theory in acupuncture. Anything you can, like that is also answer one of the questions, say, wow, how my feet is just too painful to touch. Then do the hand. The mirror location will help. Then how to mirror? The right foot mirror the left hand. The right hand mirror the left foot. So if the left foot is very painful, do the right hand. Yeah.
All right. So LI4 is really great when you have emotional like stress. When we do acupuncture work in New York City, we found a lot of client has a tenderness there. Then also this is a very good point. We can use something like this to press. Okay. We don't need to dig too much. The idea is we found a sensitive spot. Yeah, it's great before menses, for PMS. Let's do the other one. Okay, so this is the point combination for the headache with kind of dull and heavy feeling, and with reduced appetite and feeling a bit down. And we use spleen 9 and stomach 36 combination. This combination also helps with digestion. It's a very useful point. So let's learn.
Okay, now I have to show my leg. Huh? Well, maybe
Okay.
just put it down.
Okay. We're gonna use
If it's
this.
far away.
Let's use this.
So this is the knee. This is the feet, right? So spin 9 is the inner part, right? So your hand, you can use the thumb to follow the bone. Again, my lineage is the bone. So follow the bone. And up to one point, you feel you cannot go more, because when you close to the knee, you'll go up. You will spread out. So when you come here, and then you little bit go out, follow the bone, find the most tender point. Usually it's between here, here, and here, like 3 points. Usually the middle one is most tender. You want to find that everybody can try, follow the bones, go up, here, and then here, here. Follow this arch. The one before the arch, in the middle of the arch, and higher. This 3 points, find the most tender point. Usually the middle one is most tender, but some people will find the first one more tender. Doesn't matter. The most tender point you massage, again, is under the bone. Everybody find it? Spin 9. This point, 10 out of 10 will have tenderness here. This one will help to release the dull headache, that with heaviness, reduce appetite, the body feel more depressed, that kind. So this we say remove the dampness. Again, this is a jargon. Where the dampness come from, information and a lot of things. Everybody find it? Any question to find this point? Find it, okay, good. Then the outside also along the bones, stomach 36. So we go again, the bone, but this one is from outside. Go. If you do it slowly, you can find a little bit deeper along the bone. Those are different points. How high we go? Usually you put the 3 fingers, find the knee. And it's around this area. If you really want to see, it's around, this area. You can find a little bit dimple and a little bit. This one usually not as tender, but little dimple. You feel fine. So if you do both hands together, go up the bone. The index finger will stop first. This one will go higher. Then you get both palms together. Stomach 36 and SP9. Any question? You can do both sides. You will find one side more tender than the other. And then Yoko had a very good point is, wow, my hand is just, finger, not enough. Let's use the knuckle, right? The knuckle go up. Then you can massage this way. So breathe in, be quiet, breathe out, relax. So breathe in, breathe out. Breathe in, breathe out. So be quiet, relax. Be quiet, relax. Then you can do it at the same time. Any question on this point? Anybody can find it? Good. Oh, that's good. So you can do on one foot and you can do on the other one. Yeah. You can see one side more tender than the other. Yeah. But we do both sides anyway. Yeah.
Okay.
Oh, somebody.
Other question?
This one we answer already.
Okay. So we're gonna do the next one. Okay. So next headache, it's the one when you have cold or flu. It's a headache with a stiff neck. Okay, and we use GB20. It's located at the base of the scalp in the depression between 2 large neck muscles. But it's remember we need to go under the skull. So Phyllis gonna show you how to find these 2 points.
Usually we use the thumb to massage, but have to, the finger get support. Otherwise, it will be very tiring. So you see my head support, right? So both thumbs, starting from the middle, we can find the middle easily because there's a 2 big tendon. So in the middle, then we go across the 2 tendons, then go underneath. That is GP20. Everybody find it? So be quiet, relax. Be quiet, relax. Be quiet, relax. Everybody find it?
I think they're trying. Yeah.
Both start in the middle, then go across the 2 tendons and go underneath the scalp. Not on the scalp, go underneath the scalp. That is very tender. Usually tender, especially in winter time. Fengqi, that is GB20. Very good for wind-induced headache, like when you get a cold or flu. Wow, the neck is stiff and the head feel heavy, headache. This is very good for that. Yeah. Will release the neck pain and the headache and also help the cold to recover. So everybody find that tender?
Yep.
So both, usually this point we do at the same time. We seldom just do one point. I guess it's convenient, together.
Okay.
The more you massage, the tenderness will reduce. So in the beginning, if this feel is very tender, then you can do lighter hand. As the tenderness reduce, then you can go deeper. Yeah. Okay. Everybody find it? Any question on this point?
Yep.
Okay.
It have to be tender spot.
Yeah.
Okay.
Oh, there's some question.
We are checking the question, right?
What should we do in I'm not seeing screenshot. Are we supposed to see them doing this in real time on screen? What do you mean by not seeing screenshot? Marlene, are you changed to speak to you on the top?
Yeah, I don't know how to do it, but that's okay. I can visualize it anyway. Yeah.
Oh, I want you to see it. Oh, maybe we stop the share screen, but we cannot. Then you have to show this. Change the speaker mode. That is the wheel. Yeah, on the wheel, then you change the speaker mode. Maybe too small for them to see, right? Speaker mode. Or maybe here, and then we stop the sharing. Then you can see more. Okay.
Okay. So the
Ooh, you tried the coffee? You like it?
okay.
Try it first. No. Try it. Try it. Yeah.
Okay.
Okay. So this is a 3-point An Mian. It's kind of hard to find the spot for the acupuncturist, but for the acupressure, it's have to be just a tender spot. So now we know how to find the GB20. It's go a little bit toward outside, and that's it. And
I'll show you.
yeah, it's gonna show
Maybe
you.
we stop the sharing.
So we're
and then
gonna stop the
then the screen will
sharing.
be bigger. Yeah.
And so we can show Phyllis bigger. Is this better?
Across the big tendon and then go underneath. Oh, very tender. That's GB20. And then we will go a little bit outside, more outside, all the way up to end of the earlobe, right? So from the GB20, go out all the way to the end. By the ear, which point is more tender? That one will be your An Mian. An Mian means sleep nicely. So sometimes too many things on our head. Wow, I cannot calm down. So then I will go here, find my GB20, and then breathe in, be quiet, breathe out, relax. And then I go another one, find the most tender point. Then I massage that. Yeah. Be quiet, relax. Be quiet, relax. Be quiet, relax. When I say relax, from top to toe, I relax all my muscle one by one and do this. And then we sleep. You know, when we sleep face up, and then we can do my hand here, massage most tender point. That's An Mian. Usually people ask how long. My master said 15 minutes. But for me, I find out if I do my breathing, be quiet, breathe out, relax. When I lie down and relax my muscle, for me, 5-10 minutes, I sleep. Yeah. So we can try, yeah, find the most tender point. Yeah. Any question on this point? It's between the GB20 and the end of the year, usually in the middle, but everybody could be slightly different. But remember, go underneath the scalp. Yeah. And then the tender point is An Mian, sleep. People, any question on this point? Find it, the breathing exercise. Okay, good.
Okay, the last one we like to show is a nausea point. Do you have the wristband? Yeah, no. Okay, so PC6 is located at between the two tendons on the inside of the wrist, about 3 fingers below the wrist crease. On the picture on the left, you see how I place the hand, but make sure the point is very small. It's between 2 tendons. You find 2 tendons when you make the fist and kind of flex, and you find the 2 tendons kind of popped up, and you don't feel tenderness there, but you can find around the 3 fingers down, and we press. Okay, so that's
So when you put your hand out, when you hold your fist, and then you see the tender pop up, put 3 fingers. So it's around here, between. No tenderness. You may have some tender, but you should not. Maybe a little bit, yeah. Then you massage. Does this work? Work very well. I am a person that usually have motion sickness and then nauseous. So when we go on cruises, wow, I will be the person who really, can walk straight. What can we do? And then on every cruise ship, they have motion sickness pill. And they also sell you a motion sickness bracelet, right? You see those bands with a little plastic dot, and then you put in here. Then it works. Well, every time for me. And then one time I see some young girls say, oh, it doesn't work. And I check, oh, the point's wrong. So I adjust for them. And then everybody happy. So remember, it's in between two tendons. Put your 3 fingers and then, here. Put the dot here on both sides, the band, and then help. When you don't have the band, you can massage here. That really help the nauseous, no matter it's from moving rocky, ocean, or from the unsettling of the stomach. Yeah, it really works. And then if we have needle, then we will put there. And this point is also good for other things. So, but yeah, here we talk about nauseous. So when you put the needle in between two tendons, your hand has to be, don't move. When your hand move, wow, the tendon twists. The needle there will be painful. So there's also one advantage of acupressure. You can pressure it and then you move, no problem. If the needle there, your hand really cannot move. Otherwise, it will be very painful, right? When the tendon, twists around the needle. Okay, and then if you see, sometimes you have a blood vessel across, right? You see the blood vessel across. Then people ask me, should I press on the blood vessel? Usually will be slightly before the blood vessel. If you see a blood vessel across, will be slightly before the blood vessel. Yeah. Any question on this point for nauseous? Everybody found it?
How long do you hold it for?
Very good question. Until the nauseous go away. So that's why in this, actually easier you get the band because then you have both sides. Yeah, here you have to do, until it go away. So again, breathe in, press, be quiet, breathe out, relax. Be quiet, relax. Be quiet, relax. Yeah. Be quiet, relax. Be quiet, relax. Yeah, then you do it. Everybody find it, right? Yeah. Be careful when you see the blood vessel, pass slightly before the blood vessel, usually. Yeah. Otherwise, later we go, wow, how come my hand is, numb? Okay. Any question on this one? Yeah. Okay. We get some. Any other questions? Yeah. Which point you like the most? Which one that apply to you the most?
Yeah, that's a very good question. For the PC6 for nausea, it's better to keep the pressure on for a while, but we can't do that. So if you have band, you wear both sides, make sure the dot is between the tendons, so you can wear it for a while. And also when you see acupuncturists, they usually give you the little seed. They're gonna apply the seed. It's a sticker needle. And then you can wear it. So you see acupuncturist, and then you come home with the little sticker so that it's working even after you leave acupuncturist office. So this is a great point for, you can ask the acupuncturist for little
The seed, right? The seed,
yeah. Okay, so any questions? I think this is it for now from us, Jillian.
And now I was thinking how useful this is for whether you're in treatment, have never been in cancer treatment, just to know ways to help navigate pain that you're experiencing in terms of whether it's just a headache or nausea. So thank you.